So in this section, we're going to do a question and answer session with the Minister for Health and Social Care, David Ashford, who's joining us with a beautiful collection of books behind us. And to understand that, you need to see part one of this interview. Mr. Ashford, as always, questions. I've tried to put them together in some sort here, but excuse me if we do double up. And again, people always say, why are you asking this? Why are you asking that? These are from people who have written to me, and I think it's only worthy that we go back on some things that you may have dealt with. And you know the same, you get these questions, don't you? And sometimes
answers can change.
Exactly.
Everything is fast moving. More than happy, even if it is the same answer, then a bonus, because it means I know the answer to it. But if it has changed, we'll certainly try our best to try and answer them.
Right, but I haven't had this one before. Can you ask if the bowling greens are allowed to be now used for practice?
Not to my knowledge, Paul, at the moment. Technically, under the regulations, I suppose there would be nothing preventing it if someone was completely on their own. But the issue would be that they would really be having to probably use equipment that might not be theirs, etc. So at the moment, I would probably say the answer's no on that one.
Right. Dr. Hewitt said a few weeks ago that the Kent variant had a shorter incubation period. Yesterday, she contradicted herself and said it was a longer incubation period. Could you ask for clarity, please?
Yeah, I can clarify that, and that is simply the scientific evidence appears to be shifting. We just spoke there about how answers change, and one of the things that seems to be shifting is that initially it appeared that the Kent variant might present itself earlier. But as we've got more and more cases, it appears that actually it's presenting later in the incubation period. That's not meaning it's got a longer incubation period than the other variants. It looks like it's still the same. It's still around the 14-day mark top end, but the people remain asymptomatic for slightly longer. Now, we didn't have that information until the number of cases, and this is stuff emerging in the UK as well. So at the time the Director of Public Health made the first statement, that was the scientific position. But as with all these things, it changes. And the key thing, and I've got to say the key word with all of this to caveat with, is that word may. These things have to be properly researched, but certainly of the evidence we're seeing more and more 13-day positive tests from people than we were previously. So that does potentially indicate that people are actually ending up developing symptoms later in the day than they were previously. But again, the key emphasis on that is may. There would need to be proper scientific research done around that.
Next question, it's come in various forms. It's about the bubble with somebody and how you should only meet inside. And that's really confusing a lot of people, because everyone's been told from the word go that this virus is better to be dealt with by people meeting outside with lots of fresh air. And you actually say you can't do that, or that was what the opinion here was. Can you clarify?
Right, that has now changed. People can, if they're bubbled with someone, go out for exercise with them, and they can car share as well. The reason was initially when we brought in the bubbles, it was about mental health support for people who had no other human interaction. So it wasn't meant to be a great piece of socialising. It was supposed to be someone calling round and having a quick check-up on someone to make sure they were all right, a brief conversation, and then move on. It wasn't about someone coming up, sitting down, spending the whole afternoon with someone. That wasn't the intention behind this. It was about mental health checkups and people who were completely isolated having some form of human interaction. Now, as case numbers have come down, we've been able to relook at that. In fact, we were able to relook at it several days after. And we were able to expand it to exercise and to car sharing, so people can now do it. But I think the problem was people thinking what the bubble was for. So it wasn't just around someone going around having dinner, lunch, tea with someone, staying all day. It was supposed to be a mental health checkup for those who otherwise would have had no human interaction whatsoever.
Could I ask the Health Minister as to why the orthopaedics surgeries are continually being cancelled? It seems this sector is being targeted at a drop of a hat. Why can't doctors be allowed to run their own departments and plan their surgeries as they see fit?
Because we currently have to position the services elsewhere. The priority has had to be the response to COVID. It's not just orthopaedics that is affected. Obviously, orthopaedics is a major one because it's one that's already got backlog lists. But other forms of elective surgery have been affected as well, as we've had to position medical professionals elsewhere in order to deal with our COVID response. And the simple fact is we have not had the staff available in order to be able to do that, to do the lot. It's unfortunate because we need to ensure that other lists and other conditions are treated as well. And after this is over, I say we, but of course it'll be a brand new world from April the 1st, which we've already discussed, Manx Care. Manx Care will need to work with the department so we can look at what solutions we can do to bring those lists down. I think, as I've said before, we may look to try and source help from the UK in order to bring the lists down, but we do have to be very cognizant of the fact the UK is in a very similar position, because in fact they've been in a position for longer than us, so they have their own lists to deal with as well. But we do need, particularly in the orthopaedics area, to see what we can do to bring that waiting list down, because I'm not going to beat about the bush on it. The list is far too long and people shouldn't be having to wait that long for orthopaedic surgery.
And that would be the last time we'll be asking questions on those notes, I'm sure. This one also has come up before, but let's try again. I had my 13-day test on Sunday, which came back positive. My family have had theirs this morning and are waiting their results. Should their results be negative, are they free to go about even though I still have to isolate until Sunday? I'm asking this, I'm under the impression that you all have to isolate if a member of the household is positive, regardless if your test comes back negative. However, I see other people think differently.
Right, so this is where there does set in confusion. Right? So if the person themselves is positive, if they've come back positive and the other household members come back negative, the other household members will still continue to have to isolate, because there is still the possibility they could become infected. So their clock effectively resets for the 14 days. If you have a household where someone has been positive and they have recovered, they are then free to go about their business, because the risk of them being reinfected after having had it within 3 months following is absolutely marginal from the scientific evidence that's emerged. So someone who's been positive in the household and recovered is free to go about their business. Anyone who's tested negative throughout would have their clock reset based on the last positive test within that household, because they could have been infected very late in the day and they could still be incubating the virus for up to 14 days. So I don't know if that makes any greater sense for people, but hopefully it makes some sense.
Someone I know who's in their 40s had their COVID jab last week. Within an hour of getting home, they were taken to Noble's Hospital, suspected reaction to that jab. They did have some health problems, type 2 diabetes, and on the last day of antibiotics for a chest infection. But I suppose the thing is that a link there, or is it just...
I mean, that's something that would have to be investigated. I mean, that's why we form part of the yellow card system, which is the way of reporting any issues with the vaccine. I can't comment on individual medical circumstance that I don't know, and I don't have the entitlement to know. But what I would say is, certainly from the evidence that's emerging, there's no direct links between, certainly in wider spheres, the vaccines. When you treat people with of certain age groups, it is only natural that people will get ill with normal circumstances. But I honestly couldn't comment on that case because I'm not aware of it, and nor would I be entitled to be aware of it.
Can you have your views, please, on home test kits for COVID-19?
Right, home testing kits, one of the big issues. I mean, the technology is actually improving, but I've got to be fair to it. So they are becoming more and more reliable. But the problem is there is widespread testing out on the market. So there's the home testing kits that are PCR testing kits, but even then it depends upon the quality of the lab that you're sending them over to, where you can end up with false positives or false negatives. Equally, you've got the antigen kits that are slightly different. Now, again, there's a wide range of kits on the market. Some of them have an accuracy rate of about 94%. Others can be as low as 33%. So I would actually urge people caution around home testing kits. And also, one of the problems with COVID-19, again, as an incubation period, it's got 14 days. And we know in those very early days of COVID-19, even with PCR testing that looks for the physical RNA of the virus, you can test negative but still be incubating it and go on to develop it. So I just urge caution around people deciding they were going to make decisions off the back of home testing kits.
Yeah, as you say, everything develops more and more, doesn't it? It's just a question of when you can sort of totally believe in any of these things, because there was this factor of not getting the right results. But anyway. Fluid fluid-resistant face masks are not being given to everyone having a blood test. Why? I was at the hospital yesterday and nobody was given the fluid-resistant mask or even offered one.
Well, I'll have to have that looked into. I'm not sure why, because all patients or anyone being treated at Noble should be given a mask. In relation to the blood clinic, I'd have to look into that. If it was certain individuals, then it may be they've got underlying medical conditions, which is why they couldn't. But if it's everyone, I will have to have that looked into. I'm not aware of that, but I thank the person for raising it, because I will raise it myself and try and find out why that's the case.
And staying at Nobles Hospital, refusing to permit people to be at the end of life in the ICU at Nobles Hospital. Is that true? Nobody can visit?
No, people are allowed end-of-life visits. One of the issues, of course, around end-of-life visits is if illness sets in very, very quickly. It can be very hard, if someone suddenly becomes end-of-life and deteriorates very fast. It's not always the case that relatives can get there in time, and that is the case, sadly, in normal circumstances as well. But end-of-life visits are permitted. They always have been permitted. For end-of-life patients, they will always be facilitated where we can. And like I say, if someone deteriorates very quickly, then that isn't always possible.
And is it one person, or is there a limit to the people who can go?
It would be taken on a case-by-case basis. Generally, we would prefer one person, but obviously, if there's a lot of close family, then we will try to facilitate visits based on the individual case.
Okay, we're now going back to infotainment, which is a word, a made-up word, I think, the Director of Public Health came up with. It was during the last briefing, or when this was written to me. They keep data and figures of day 1, 6, 13 tests in order to understand better the effect and the need for these tests for our border policy. David, and especially Henrietta, clearly said that because it's a manual process, they don't have the data since it's not necessary, and they don't provide that, and ask someone to get that data was for our infotainment. Surely this data is very important.
The first thing is, I didn't say it was for our infotainment, but in relation to that, my understanding is it is a manual process. So while we know how many people are undertaking day 1, day 7 and day 13 tests, so we could quite easily publish that. So for instance, on the figures I have in front of me when I talked to you there about when I have my iPad, when I spoke to you in the last section about that, Paul, on my table breakdown, it says how many tests have taken place for day 1, day 7 and day 13, but what we don't have is the breakdown of how many of those are positive. The lab, when they process tests, don't process tests as a whole. They don't necessarily know whether it's day 1, day 7, day 13. That would have to come from 111, who would need to go through all the various results and record that separately. So that would be a manual process.
I got a long question from a dentist, but basically, dentists are now being allowed to open from Monday, is correct, and to treat all patients?
Dentists have in place standard operating procedures that they still need to follow. They need to ensure that they operate, that they operate within the rules that are in place. And one of the things I would say with dentists, no dentist is being forced to do anything that they are uncomfortable with. If someone is not comfortable doing something, then they shouldn't do it.
But they are going back to normal from Monday, is that right?
I don't think full normal, as far as I'm aware. I might be completely wrong on that. But certainly we've been able to start winding things down slowly again as cases have gone down.
And finally, this is from someone saying, just wondering if you can find out why the island is not getting any Pfizer vaccine at the moment. My daughter's a frontline worker undertaking placement in the UK NHS hospital. She had her first vaccine there in January. The second one was due the 9th of April. But she came over to the Isle of Man in the meantime, and this person rang 111 to see if she could have a second jab here, and it was yes, and then it was a no because they said they hadn't got that vaccine.
Yeah, well, we do have Pfizer vaccine, but it is in limited supply. So we have to prioritise those who are already booked for their second dose of Pfizer, and that's what we've been doing over the last few weeks. We've received 1 tray of Pfizer, I believe, a week, and that's it. So it's not a case of we don't have it. It would be the case of the person would probably have to wait because there were other people already booked in for those trays, because we were still doing the people who were lined up for second doses and were initially booked. but it will become available, but it is more limited than the AstraZeneca. The UK placed an awful lot less orders than Pfizer. The Pfizer deliveries slowed down as well. We spoke a while ago about this, where they've been doing work on their Belgian plant, which is where the whole UK stock comes from, in order that actually, ironically, in the end, it will speed up deliveries and capacity. But while that work's been ongoing, the volume of Pfizer produced going into the UK and therefore onto us has dropped lower. So we would receive approximately one tray a week. So that person will be able to get their second dose of Pfizer, but the vast majority of the vaccine is AstraZeneca.
Right. I mean, this person was going back probably to have it and was seeing if she could have it here. I think that's the reason that. Just to finish with, how are you doing with the vaccine? I mean, you get asked this all the time at the press conferences. Always on exactly the same mathematical formula as always with the UK?
Yes, we are. We are actually ahead of the UK in overall doses delivered by roughly around about, I think it's 6% now. So that's first and second doses combined. First doses, we are slightly behind the UK. We're again about 6% behind that, but that would be because we didn't change to the 12 weeks until the scientific evidence emerged in February. We are ahead in second doses, which isn't something to be critical of. That's actually something to be praised, because it means more of our population have actually had the full protection. And I think now around about 17-18% of our full population have actually completed the vaccine programme. So it's gone on track. As you say, Paul, we've got all the letters pretty much out now to the priority groups. The last of those will go this week, and then we will look potentially to get the next age range, which will be the 45s to 50s out, potentially back end of next week. So it's going at speed.
Well, thank you for your time again on this Sunday. I have to say that because obviously things can change by the minute when people watch this back maybe later on. Once again, if the public have any questions, do get in touch with us here through all the usual various ways people get in touch, and we'll talk to you next Sunday. But hopefully in the week, you reckon the Monday and the Thursday press conference? I think
that's what we seem to be sticking to at the moment. So I would suspect there'll be a press conference tomorrow and then one on Thursday after Council of Ministers is sat.